Yeah, so that is really what the trends are looking like, at least for some patients who receive the gene therapy, or in for this particular product. However, I think time will tell, and it's a reason why the follow-up, either as part of the clinical trial or the some national and international registries are really critically important to see both the trend of the factor levels, but also the clinical outcomes, because certainly vast majority of patients have responded, and even with some decrease in factor expression over time, have stopped prophylaxis, remained off prophylaxis, and had very low bleeding rates. But I think the thought of a cure where you get to 100%, you never have to have any type of hemostatic treatment, and it lasts for the rest of your life is not the expectation. So I think when patients are considering the therapy, they really have to understand what we know about it now, what has been seen in clinical trials, and then as we get more data, how what those data show. Yeah, so if I'm remembering correctly, I mean, the one particular patient that didn't respond at all was one that was not able to complete the infusion because of allergic reaction, and then at the time was not able to complete it. So that patient did not have response, and one of the issues with this type of treatment with the viral vector is that once you get any exposure, then your immune system is going to have very high reactivity, and so you can't get re-dosed. But then outside of that, there were some patients who really, didn't get, up into the mild range, and, some who, stopped prophylaxis, but then needed to go back on.
Right. Okay.
But still the minority of the patients.
No.
It is a significant issue. As I mentioned, like liver health is critical importance, and at least with the current protocol, if there's any sign of liver inflammation, immune response, indicating immune response against the vector, then then the corticosteroids are initiated to avoid loss of efficacy, because you have one time shot at this, at least now, and so you have to be very conservative in terms of making sure that therapy is going to work. So I think it's a question of longer term in terms of can we be smarter about either prevent using corticosteroids up front to prevent any liver inflammation, or knowing exactly who has to have them to maintain response. And then in terms of the side effects, so I mean, the duration of corticosteroids is expected to be fairly short. I mean, it's not at all something that's going to need to be lifelong, but there can be significant side effects, some which can be a little bit more nuisance, like you have a little grumpy, or or have more are hungry in the middle of the night, but some that can really have impactful behavioral or can have an impactful behavioral problem with sleep, or interactions with others. There are other concerns, sort of the longer you take it in terms of bone health, cataracts, sugar control, blood pressure. And so that's another thing in terms of transparency with patients who are considering the therapy. They need to know, okay, well, this is who can be eligible. This is what the treatment looks like. These are, potential side effects and how likely or not they may be. And then this is how we'd have to manage them, because that could really impact, decision making. If someone's had bad experience with corticosteroids, or maybe they're at risk for diabetes or already have hypertension, then it might, that could impact decision making about the treatment. I guess the way I have thought of it and learned about it is more to protect the therapy. Since we actually haven't seen like liver damage or decrease in liver function, it's more this inflammation and immune response. That being said, if someone had long-term liver inflammation, that would certainly could have impact on liver health. But I think up front, it's really to protect the response.